Is it look? Yeah, it's working.
Yes.
Yeah, great. Hi everyone. My name is Caglar. I'll standing while I'm talking, and I'll sit down to the clicking. As is said in the beginning, I'm a lecturer in urban planning at the University of Manchester, and today we're presenting our research on 20-minute neighborhoods. In hindsight, perhaps we should have gone first because we're actually going to talk about what 20-minute is and the literature we've done and how it be applied to Manchester and Salford. And I've done this research with Florence, who was my student at the University of Manchester. I should have said top of the class when you graduated. And now you was working as a planning consultant at Enzygo, and also Graham Sheriff from University of Salford as well. This research was a response to a seminar we did back in May 2022. So that was so 20-minute neighborhoods was just getting traction internationally, and we thought that why don't we come together as planners in Greater Manchester, people working practice and some academics, and talk about this 20-minute neighborhood, see that if there's any scope for us to do any research, and what are the issues that our colleagues in practice perhaps might highlight. And I think the feedback that we received from that seminar last year was there was a reluctant optimism. Lots of people thought that 20-minute or 50-minute cities were actually a good idea. It spoke directly to the heart of planning exercise, that creating livable places where people can go to, work, to shop, the bus stop, whatever, like in walkable distance, creating healthier communities, etc. But they weren't sure if the 20-minute neighborhoods was a good idea to look at this in addition to all the different frameworks we already have in the UK. And also they weren't sure, is 20-minute the right idea? What about 15 minutes? What about, other people with mobility issues? What about, children? There was like lots of what abouts. So we thought, okay, what we're going to do is we're going to go away, do a bit of research, as what people in the universities do research, collect data, do a bit of testing, piloting, and then see that what it will lead us. And today we're going to present the results from our first phase of our research. So what we're presenting today was published in Town and County Planning Association's journal. So it's basically two papers. The first paper was published in March and April issue, and the second paper is forthcoming in May and June issue. So if you want to read more about our methodology, what exactly found, and further information about what we found, you can read those the TCPS journal as well. Then I'm going to need Florence to give more information about what they actually found.
So these two articles arose from a literature review that I did last summer as the first step really towards seeing how this concept is put in practice, as well as what the theory has to say on the subject. And these are some of the questions we sought to answer, really trying to answer what is a 20-minute neighbourhood, or indeed a 15-minute city, and should we all be getting behind one of those? Is one question that we could be asking. And then Caglar is going to talk later about how this was applied to Manchester and Salford with this interactive map.
Next slide, yeah.
So I assessed all the literature that was currently on the topic up to last May and June. And I found 26 papers, most of which were from 2018 or later. I think it was something like 92%, which really shows how the topic has snowballed, and the field has suddenly got quite crowded very quickly. I think, to be honest, this could be done again, maybe this autumn, next year, as it gathers pace and we find still more papers to add to it. But as it was, we found 26 papers, and they were from a wide range of backgrounds. I think the most commonly studied city area was Melbourne, either the city centre or the city region, but it was a pretty wide range. Those are the actual authors given there in terms of the backgrounds. And it really raised a lot of questions. It gave a pretty good picture of what was already quite a rich field, but it also showed that there's a consensus. I gathered all the possible services and facilities that the literature suggested should be in a 20-minute neighbourhood or a 15-minute city. I included both, and categorised them, as you can see from the table. So the most common was retail. Retail was 19 papers, followed by food and education with 18. But even within those, there was a great variety of different facilities people thought could be included. So primary school was most common within education, for example. Do we also want a nursery? Do we need a secondary school in every 20-minute neighbourhood? Some people think so, 7 out of 26. And other questions that were also raised included, what's the mode of transport? So if it's a 15-minute city, for example, 15 minutes by bike or 15 minutes walking. And how far is that really? If you're walking, whose walking speed actually is it? So some of the literature did try and put a walk speed to that and actually calculate a radius based on the ground conditions sometimes, or sometimes just a simple circle. But is that, for example, an elderly person walking to a facility, or someone with children, or is it a healthy person walking quite quickly? This really affects accessibility and whether a 20-minute neighbourhood or a 15-minute city really does have everything that the entire community need. And this also links to questions of what's included. We've got an elderly care category down here at the bottom. So do we need to be designing facilities for specific cohorts into our 20-minute neighbourhood? So we've got a school for older adults, just one paper suggested, or a recreation centre, so some sort of community hub where that demographic can meet. And also up here in green space, we have a playground or even a park, could technically be for a family cohort or for children, though it serves probably a wider demographic than something more specific. And the final question that was also raised was about quality. We've got a sort of tick list approach here in terms of quantity of facilities and where they're located, but can we somehow incorporate calculations of quality and assessments of quality into the 20-minute neighbourhood concept, or is that beyond the limits? So, for example, a park, does it meet requirements? Is it big enough for all the people who want to use it? Is it in good condition? Does it have play facilities? And so really what we found was there is an awful lot of interest in 20-minute neighbourhood, but not an awful lot of consensus at the moment, which I think I found challenging when trying to apply it to a city region.
Yes, very true. So the research was very useful. So it confirmed that what we thought was going to happen is that it depends. It depends on who do you ask, what, how they define 20-minute neighborhood. Also depends on where you're trying to apply this, what sort of population demographic actually living there, what sort of services that you think that are actually important. So it depends. So what we did next was we tried to apply this lens to Manchester and Salford, because I live in Manchester, Graham lives in Salford, he works in Salford, and we thought, why don't we actually try to apply this lens to Manchester and Salford? We found a bit of money from the university, we hired a researcher, and then we do some data crunching. And then we try to apply what Florence found in her literature review to Manchester, and what essential services should be in Salford and Manchester. So based on the literature review, we decided on the essential services that you will see on the table to the right. For example, we said that what we think is essential in terms of health facilities is chemists or pharmacies or GP surgeries. We thought from the health perspective, these are essential. From green space, we said green space or open space are essential so long as they are bigger than 2 hectares in size. Anything smaller than that, we thought that's just inadequate. In terms of community facilities, we thought, or retail, we said post office or a cash machine. These are definitely essential. So based on literature review, we come up with a list of essential services and amenities. If you apply this to, say, another city like Leeds, you probably wouldn't put trams because Leeds doesn't have a tram network. But in Manchester, we have, so we put that in the public transport section as well. And then we thought, okay, we need to do a bit of a survey to actually understand what people in Manchester and Salford want. There's no point going around saying that these are the things we're going to do without actually asking people that what they think, that, what sort of things that they want to see and what are the challenges. So we launched an online survey and we received 75 quality good responses, full responses. I think over 100 partial, but some of them are not usable. And and what people told us overwhelmingly in the top table, you'll see they thought, okay, public transport, it's essential. I want to be able to access the public transportation, whether it's 10 minutes, whether it's 15 minutes, but it should be in a walking distance. Green space or recreational sites, again, it's essential. Health and well-being services, most people said it's very important to them. Some people say it's somewhat important, so not necessarily it's something that they want to see in a 15 to 20 neighborhood. Community facilities, most of people said it's somewhat important. They didn't think it was essential, but those people said it's essential. They said, we definitely keep losing them. We need more pubs. We need more community facilities where people can come together without any entrance fee or anything. Some place that actually you can see that, there's a community living there. Yeah. We also wanted to understand, as Florence was saying earlier, what are the barriers? Quality, affordability, road access, safety from traffic. So in the bottom graph, we share the slides after the seminar, Graham. So we'll share the slides after the seminar as well, if that will be helpful. We asked people, what are the barriers to actually accessing those services? People told us that concerns from road safety because of traffic is very highly rated. The quality of the shops, retail shops, was also rated quite high. Time spent crossing the roads, inaccessible payment space, payment width, that was a big issue. So we also try to understand what are these challenges with the 20-minute neighborhoods. So based on all this feedback, we created a map, which is interactive, which you can actually click on it. And now this is what I'm going to try to do now, see if it works. If I click the demo link. And is my screen shared on Teams, Graham?
There's a slight delay on it.
Yeah. So there's delay, yeah. So essentially, this is a public map that you can access to, and what it shows that which areas in Manchester and Salford are confirmed that 20-minute neighborhood idea. The dark green the map is still loading, is essentially the areas that, is excellent. You can have access to retail, green space, GP surgeries, and also the other facilities. The darker colored, the red colored areas, or light green, are the areas that have problems, and darker red, the areas that, rural Salford, you can expect there's no services essentially. What is highlighted though, interestingly, so in city centre Manchester, by the way, what we did is quite different from other research on 20-minute neighborhoods. We mapped it for each household, so you can actually click on individual households and then find the individual score. We're not going to do that now because the map is taking quite a long time to load for some reason. But in city centre Manchester, where we think that all services are easily available, it's not as green as you might expect because of green space, lack of green space, lack of health facilities, and there are a few areas in Koksal because of the road design. It's not accessible. They don't have good access to retail shops. Same thing in, say, Heaton Mersey or River Mersey, where there's lots of households that are actually quite red because they're far away from essential services. They are car dependent, and then it raises interesting questions about carbon footprint. Subject to further funding, which is what we're trying to do right now. We're talking to planning colleagues in different districts, trying to find some money and some research support. Is we want to put deprivation information, health information, housing allocation information, carbon footprint allocation on this map. So when you click on each household, it will give you its 20-minute neighborhood score. It will give you its health score, its carbon footprint, car ownership. So you can see how these things are actually related with each other. You can see that if 20-minute neighborhoods are actually a good idea to create healthier communities, where it's working, where it's not working, where the service provisions are lacking, and perhaps if there's a housing coming forward in certain area, whether they also need to bring further services as well. So this is the future plans. Slide.
So just to wrap up, we've drawn 4 key conclusions from the research, and these are presented in the first article, the one that's published at the moment, about the 20-minute neighbourhood concept and how it's applied. The first is really about scale. We need finer scale data than we can have at district or borough level. We really need neighbourhood level data, both from data gathering, but also talking to people, talking to communities on the ground about their individual needs. That can then be applied at neighbourhood level, for example, put hopefully into neighbourhood plans or other sorts of community level plans. I talked a little bit about quality maybe being beyond the limits of the concept of the 20-minute neighbourhood. Is that something we can incorporate? This is really something that needs testing. Where is the limit of the 20-minute neighbourhood concept? A couple of papers talked about what I've termed higher order facilities, so hospitals, ports, airports. We can't put these in every single neighbourhood because they serve a bigger population. Is that outside the limits of the 20-minute neighbourhood? Or can we somehow use the concept to decide where to place them for maximum accessibility? Delivery of this concept is going to take more than planners. It's going to really take an awful lot of collaborative work between different stakeholders to ensure we've got the infrastructure, the environment, the economic backgrounds, bases in order to deliver this on the ground. And finally, we mustn't lose sight of the real purpose of the 20-minute neighbourhood. We need to move beyond just having a tick list of services, plotting them, making sure they're within our either 15 or 10 or 20-minute, however you define it, radius. These are meant to be places that people can live dignified lives and sustainable lives. So we need to somehow strike a balance between looking at lists of facilities and seeing where they are, but also remembering that it's supposed to be for all of us to inhabit and to create future neighbourhoods.
That was us. Thank you very much.